Thank you so much, Mike. It's a pleasure to be back on campus and to be here with you all. So, Election Day is 1 week away. If your mailboxes and your voicemail messages are anything like mine, you have seen that campaigning has ramped up even just in the past few days. If the campaign mailers, TV ads, and the news are any indication, health is indeed playing a big and significant role in the midterm elections. Candidates from both parties are raising the issue. Raise your hand if you've seen an ad about health in the campaign. Yes, all of you, I presume. The Wesleyan Media Project determined that nearly half of the ads in the midterm elections addressed the issue of health, and it was only 10% in 2016. Voters are paying attention. My colleagues from the Kaiser Family Foundation on the polling team recently reported that more than 7 in 10 voters said that health is, quote, very important in making their voting decisions in the congressional races. As we will hear more about from our distinguished panel, Democrats and Republicans disagree on how to protect people with pre-existing conditions. And they disagree on the Affordable Care Act, reproductive health access, and of course, on Medicare for All. Some of the biggest debates around healthcare, however, will occur here at the state level and in states across the country. For example, there are initiatives in 3 states that would allow voters to decide whether to expand Medicaid to more low-income residents. And there are also, of course, now including California, 36 governor's races around the country, including many with open seats. And in most of those races, California among them, the candidates have quite different views on healthcare. Overall, the outcome of the midterm elections, both the congressional races and the governor's races, will likely have an impact on health policy for decades to come. So over the next 90 minutes, a little bit less, we're going to talk about several issues. We're going to cover the future of the ACA, the single-payer movement, and a very expensive campaign around a ballot initiative in California on dialysis care, which I'm sure, again, you have seen lots of ads on. All right, so here's how it's going to work. Each of our presenters is going to have about 7 minutes to make opening remarks. Then I'm going to get the discussion going with some questions. I'm going to, like Mike said, hopefully some challenging questions. And then I'm going to open it up to you all. And we'll have students walking around with microphones to help us out. So be thinking of some questions. All right, so for our first speaker, I'm going to introduce these very briefly because you have nice detailed bios in the brochure pamphlet that you hopefully got when you walked in. So I'm going to make a brief introduction first to Dr. Gerald Kaminsky. He's going to start us off. He's a professor of health policy and management here at the UCLA Fielding School of Public Health and a senior fellow at the UCLA Center for Health Policy Research. And I will introduce the others when they come up afterward. Go ahead, Dr. Kaminsky.